Hi, Dr. Bucking. My question today is about rapid tests, and I believe that the general community thinks that they can take a rapid test and then visit people at gatherings over holidays. And so I'm just asking if that's the way it works, or if you would like to speak to how rapid tests work and how we can best be using them.
Mm-hmm. So it's tricky because I think prior to Omicron, we were really hoping that wider availability of rapid tests could be used really to enable people to attend more social gatherings over the holidays. I think with Omicron and knowing how infectious it is, certainly we know that rapid antigen tests are not 100%. They're not perfect. They're kind of 60 to 65% sensitive. So not always certainly detecting virus. It could just be if somebody has COVID-19, the virus level is not high enough just at that point in time that it tests positive. I think that right now, and as we move into the holidays, I would not be counting solely on rapid antigen tests to really attend all of the same gatherings that you had in mind. I think at this point in time, we need to go back to revisiting gatherings kind of full stop and be looking at small gatherings and other public health practices to help keep us safe. If you have access to a rapid antigen test, I think you would want to use it right before you attend a gathering so that you know that really you're capturing it at the most relevant point in time just before you do go. But if you have any symptoms, if you've had any exposures that you know of to somebody else that could have COVID-19, then I wouldn't count on that rapid antigen test and I would be staying home and not attending.
Okay, great. Thank you. And then can you also speak to if you do test positive on a rapid test, what would be, should you then go to get another test, or is it necessary to report it still? What's the value of reporting it, I suppose?
Mm-hmm. Yeah, so certainly our message has been and will continue to be until there's not that capacity in the lab system. But the message has been if you test positive on a rapid antigen test, that it needs to be confirmed with a PCR test at an assessment center. Now, if you are not able to get a testing appointment at an assessment center, as we anticipate that will soon become the case, then assume that test is a true positive and that you need to isolate for 10 days from that positive test. At this point in time, if you have there are certain settings where we would, where at the public health unit, we want to know if there are positive rapid antigen tests, certainly in long-term care homes, school settings, this sort of thing. And I think from a system perspective, we're still determining what the approach is going to be as we transition potentially away from widespread access to PCR testing to rapid antigen testing.